Hello everyone. Welcome to Internal Medicine Residency Program at Texas Health Presbyterian Hospital, Dallas. I'm Dr. Rahul Gill. I am a hospitalist, and as a graduate of this program, I feel honored to be able to serve as Associate Program Director here. The interview process can be hectic and exciting at the same time. The current COVID pandemic has added an extra layer of challenge, and as we all adapt to the current environment, the upcoming interview season is going to require all of us to make many decisions. And I would like to use this opportunity to provide you with information about our program with the hopes to help the decision-making process a little simpler. Moving on to the mission of our program, our goal is to help train our residents be good doctors and the best internists that they can be. In pursuit of that, we focus on things like knowledge, collegiality, humanism, research, and that is all towards the goal of being the best doctors that we can be. Being a small program, we are able to understand the needs of each and every individual, and we try to support each and every resident in pursuit of their individual goals and passions. Texas Health Dallas is a large community-based program, and we are part of Texas Health Resources. We are a tertiary care centers and a referral center for multiple specialties, including neurology for strokes, cardiology for MIs, renal for dialysis, and trauma, and many other subspecialties. To give you some information about the structure of our program, we were established in 1970s and have grown with the times. At this point, we have 12 first-year residents join us every year. 6 of them are preliminary and 6 are categorical. The categorical interns end up graduating to be the PGY2s and PGY3s, which gives us a total of 24 residents at any given point of time. We are a ACGME accredited training center. During the first year, the interns would spend 6 months on wards, 1 month as day float, 1 month in ICU, and 4 months on electives. As PGY2 and 3s, you would spend 5 months on wards, 1 month in ICU, and 6 months on your electives. While you're on wards, we have a Q5 called schedule, which means you will be on call every 5th day. We have 5 teams on wards, 4 of which have single intern. The 5th one has 2 interns. During the ward month, you will have scheduled 5 days off. During your first year, you will do 1 month as day float. And during this month, it is an innovative time of great learning opportunity, as you will be admitting with the call team every day in the morning, up to 2 patients, and cross-covering for the post-call team, which is gone for the day, in the afternoon. And the timing is essentially 8 a.m. to 5 p.m. You will be having scheduled day off every 5th day during this month. Every resident every year will do 1 month of ICU during the first year, second year, and third year. During this time, you will work closely with our intensivists almost one-on-one. During this rotation, you'll be working 6 a.m. to 6 p.m. only during weekdays, that is, weekends are off, and you only work during the day and there are no night calls. However, vacation is not allowed during this time. The continuity care or ambulatory care is a ACGME requirement, and we have this clinic on campus. And the categorical residents during their first year are assigned a day of the week. On this day for the next 3 years, you are expected to be in clinic during the afternoon unless you have scheduled off. As far as elective goes, you have various choices to pick from, and you get to decide beyond the required electives what you would want to do. As the list shows, we have all of the subspecialties in-house. Now, because of our collaboration with UT Southwestern, many of the residents oftentimes like to do a second subspecialty rotation in the specialty of their choice at UT Southwestern. The electronic health record that we use is Epic/Care Connect, and it is one of the most user-friendly EMR that is out there. As far as evaluations go, you will be evaluated every month by the attending that you work with or the intern or resident that you work with, and vice versa. The evaluations done by residents are anonymous. We have excellent faculty here led by Dr. Mark Feldman, who is our program director and world-renowned gastroenterologist. He's one of the most astute and knowledgeable physicians I have worked with. Our core faculty is focused on education of the residents, and they include Dr. Carol and Das, who are also graduates of this program and practice as geriatrics private practice, but they also supervise the residents in the residence or ambulatory care clinic. Dr. Goodman and Dr. Wall are experienced ID and renal specialists. Our other faculty is dedicated towards the residents, and whenever you do a subspecialty rotation, you will work with a dedicated consultant or faculty member. We have a number of conferences, and every Monday to Friday during the weekdays, we have a noon conference. On Mondays and Thursdays, the conferences are taken by the faculty, and we have a 3-year curriculum. On Tuesdays is Journal Club and resident conferences that is alternated. On Wednesdays, we have hospital-wide grand rounds where we have speakers from across the country who come in and talk about relevant topics. And on Friday, we alternate between M&Ms, CPCs, and potpourris. Now, to keep in mind that during the COVID pandemic, we are hosting our conferences, but they are being done virtually via Skype. We also have daily morning report Monday to Friday, 9 a.m. to 10 a.m. with Dr. Feldman, who is our chairman and program director, and other faculty members, where it is attended by all residents, upper level residents on wards, and the presentation is done by the post-call upper level resident. Similarly, the interns get an opportunity to have a conference and a presentation with Dr. Feldman or Dr. Goodman in interns conference, where you meet once a week on Tuesdays, and during your assigned month you will be doing presentations and discussing cases with them. We do have ample research opportunities, and we do also have a research requirement which is usually fulfilled through poster presentations, case reports, or case series. After graduating from our residency program, about 50% of our residents choose to do fellowships, and we have had residents match at all over the country in some of the prestigious places, and the other half usually end up going into primary practice in some form or fashion, whether it's hospitalist or private practice. We offer some of the most competitive benefits in the area, if not in the country. As you can see, we do provide health insurance. Our residents get 25 days of paid time off each year, and PGY2s or PGY3 can use another 3 days in the 3-year time period to use towards conferences, interviews, or step 3. We also provide for white coats and scrubs. We provide for subscriptions for NEGM, Annals of Internal Medicine, ACP membership, MixApp, and UpToDate. In the 3rd year, we also provide for the board review of course to prepare for internal medicine boards. I would like to thank you all for your time and your interest in our program. We would have liked to see you all face to face. However, if you have any questions, feel free to write to us. Also, check out our website for more information on our program, for our application criteria, and next steps for the residency interview process. At the end, I would like to thank you for your time again and wish you the best for your future.